can be helpful as a measure of source control, which means that if an individual is infected and they wear a medical mask, it could prevent them from passing the virus on. I'm not aware of the particular measure that you are referencing. We can look into that and find out the reason for the recommendation for that. But it may be the case that the recommendation is that a woman giving birth would put on a medical mask for source control.
Thank you, Dr. Van Kerkhoff. The next question goes to Nina Larson from AFP. Nina, unmute yourself and please ask your question.
All right, hello, can you hear me?
Very well, please go ahead.
Thank you. Sorry, I wanted to ask, today it's been 6 months since the WHO declared this crisis a public health emergency of international concern. How would you characterize the response since then? The situation appears to obviously be getting worse. So looking back, are there any recommendations that you regret or any actions you wish you'd taken earlier to have changed the course of this? Or do you think that you've done what needed to be done? Thanks.
So perhaps I will start, and others may want to supplement. Yes, indeed, we've just hit the 6-month mark of the time where we declared this pandemic a public health emergency of international concern, which is the highest level of alert that we have under international law. And it has been a pretty incredible 6 months that we have seen. I think we can characterize the response globally as mixed. I think we can very strongly show that countries that have acted fast, have acted aggressively, have acted comprehensively, and really it's due to many countries who have had direct experience with something similar or a similar threat. Countries that had experience with SARS-CoV-1, the first SARS in 2003, countries that had direct experience with avian influenza, those that have had experience with MERS, those countries across Africa that have had experience with other infectious diseases that they deal with so often, really saw the threat, really knew the threat of this. We as an organization acted immediately. We mobilized ourselves on the day we were alerted to this and mobilized all of our forces to act and to inform. Our first guidance materials were out on the 10th, 11th, and 12th of January, which was the comprehensive package of how to find cases, care for cases, how to protect healthcare workers from infection, how to collect samples to be able to test, and a checklist to get countries ready. And so there was a lot that was put out early, and we really saw countries that took an aggressive approach, countries that took an all-of-government comprehensive approach, really see some success in the beginning of trying to combat this. I think that even countries that didn't, even countries that didn't act as fast, we are seeing them turn things around. And we are seeing many countries who had very difficult outbreaks to go through. And we've mentioned these countries over and over again, even the Republic of Korea and Italy and Spain and Germany and many countries were able to turn this around and implement this comprehensive approach, these public health measures, all of government, all of society, engaging their public, informing their public. So I think that what we are learning is that these tools work. These tools over and over again, if they are implemented, they work. They can suppress transmission and they can save lives. And I think what we need to do going forward is look at how we could be more efficient in our response. How can everyone be more efficient in the tools that we apply so that we don't have to go into large lockdown again, or so-called lockdown measures, that we can tailor the approach to the geographic area and to the transmission area where it's needed.
Maybe just add one point. I think traditionally WHO provides a global service in the area of global goods, global standards, global science, and we do that on behalf of all nations. But also traditionally we expect usually to be providing on-the-ground operational and technical assistance, usually in countries that are lower middle-income countries that have gaps or fragility or vulnerabilities in their systems. And in this case, I think what has certainly surprised me is the way in which public health systems, the slowness in general of systems to react on things like contact tracing, cluster investigation, testing, being able to bring a comprehensive public health strategy to bear. And we did focus in the early days of this crisis in really driving our technical and operational assistance to countries that we would traditionally feel that need that assistance. And if I could go back and change anything, I think we would have also been better served to be offering that operational and technical assistance to countries where I think we made some assumptions about capacities that existed in countries and skills and workforces that maybe should have existed or should have been expanded in some of those countries. And I think we're all learning lessons that there's been a deep underinvestment in the public health architecture, the capacity to do surveillance, the capacity to do contact tracing, the capacity to run an integrated response. I've said it here in the past, we end up doing that kind of fully integrated operation in extreme environments, like in Eastern Congo. And if many things around the world in many countries, and nobody gets through a crisis with a perfect score. It's just not, it's not possible. But I do think we need to look really, really hard at what we assume to be capacities for public health intervention in all countries. Maybe we made some assumptions about the existence or performance of those systems in all countries that did not prove correct.
Thank you very much, Dr. Ryan and Dr. Van Kerkhoff. The next question goes to Alejandro Aleman from Medicina Digital, Mexico.
Buenos días.
Good afternoon. Thank you for taking my question. This is the 40th year of Alma Mater, and we have in Mexico tried to ensure that we have universal access to healthcare, but we have had poor results to ensure universal access to healthcare. We know that people need to change their habits, but people also need to. We also need to change the social environment. So, what is the WHO doing to take into consideration this variable?
Yeah, I didn't quite get the full depth of your question, but I think what you were really speaking about is, well, certainly in the case of something like COVID, a disease like this exploits all of the vulnerabilities and the underlying vulnerabilities that individuals, communities and health systems have, and we've seen that. We've seen how this disease impacts on people who are marginalized and have underlying health conditions. We've seen how this impacts on people who don't have access to basic healthcare services in terms of diagnostics and treatment. And we've seen how this impacts in areas in which the health infrastructure is poorly invested in. And we've seen hospital systems collapse. We've seen huge queues of people not able to access healthcare in many countries. It's not just an issue in Mexico, it's an issue across the world. And Dr. Tedros has spoken about this many times. Health is not a reward for development. Health is a primary investment in the security of communities, in the security of the state, in the security of the economy. And I think what epidemics do very often, and unfortunately, they're a massive stress test for the system. They stress governance. They stress coordination. They stress community cohesion. They stress the trust between people, between communities and government. So what happens in a crisis or in an epidemic is, in a very small period of time, much of the system is placed under stress. And its natural resilience, how resilient and how able that system is to absorb stress determines the damage that's done. And we know that ourselves. We deal in many parts of the world with natural disasters. If you build your house well, if you build your house with the view that a storm might come, then you build a house that can withstand the storm. If the storm comes and your house is not prepared, then you may lose your house. And I think that's what we're seeing. We're seeing in these situations, in many, many countries, the absence of universal health coverage, the absence of primary health care, the absence of an affordable health system that people can access without financial hardship. Dr. Tedros has been speaking about this for years now. This is the whole core of our global program of work. Epidemics in themselves cause a major impact, but that impact is amplified over and over again by weaknesses in the underlying health infrastructure. And we're paying a heavy price again for the lack of that investment.